This segment sponsored by Indiana University Health. Indiana University Health is a nonprofit healthcare system and has so many physicians and APPs who are currently accepting new patients. And here to tell us all about their community outreach is Nia Hinton, Community Health Specialist, and Jennifer Robbins, Quality Performance Improvement. Hello.
Hi.
Welcome.
Thank you.
Yes. Okay. So I would love to learn more just about the current initiatives that IU Health has when it comes to trying to reach unserved populations. Nia?
Yes. So our main goal in being out in the community and doing the community outreach is to kind of go over, feel the need for the hypertension that's going on in our community, in the Black and Brown community more specifically. So by doing that, I'm out, boots on the ground, in the field, out in the barbershops is kind of where we're at now. I'm in barbershops, 2 of them specifically. I'm at Magnificent Cuts Barbershop and also Above Average. And we picked the barbershops because we feel like that's a good community.
Right.
Like, you see all types of people coming into the barbershop. I've seen and been able to meet all types of people by being in the barbershop. So by doing that, when I'm in there, I'm doing blood pressures. I'm building relationships with the people that are in there. I'm seeing what other needs they have, not just focusing on the health, but also seeing what other needs they may have. Because when you are worried about food, housing, utilities, it's so hard to focus on your health.
Absolutely.
So I try to tackle it all.
And so why is hypertension such a main focus with your current outreach?
That was our big goal over last year. In the quality field, we were looking very specifically at hypertension and the disparity, meaning we were looking at various populations. And what I noticed with our data in the Fort Wayne area is our African American population was so much lower in meeting the hypertension goals. So I really wanted to build a program where we could do outreach and meet people where they were in the community. Barbershops have a special place in my heart. My son is a barber, so I met Nia by chance at an event, and we really connected. I was sharing my ideas, and she already had an in the community doing some of this work, and so it was really just a great partnership that kind of melded together very quickly.
Right. And can you explain hypertension in case people are not aware?
Sure. Hypertension is high blood pressure. And what we're looking at specifically with hypertension is a number over 140 over 90. And what that means is your blood pressure is high. It could be a lot of factors relating to that. And we know in specific communities, they have higher stress levels. And so that's something we really wanted to address. We also know that it can have long-term effects. If it's not addressed and kept in check, that can lead to long-term effects later in life. So we really definitely wanted to make sure we were addressing them with the population, especially those maybe that are a little bit younger that might be just starting in this journey with hypertension.
Interesting. And so Nia, do you feel that the hypertension has to do with it being greater in the African American community, or they have less access to getting help or seen or prevention for that particular disease?
I think both, to be honest. And I say both because being a Black woman, there are certain pressures and certain burdens that we have that other cultures don't.
Right.
So I think that that's the issue in and of itself. And then healthcare being not as accessible to us, yes, that is true too, especially in certain areas, because transportation, not having a bus stop to transport or not even having a vehicle to get there, lack of community, and also lack of trust in healthcare.
Right.
That plays a major part in it for me, because a lot of people that I do talk to and encounter, they're like, I went to the doctor, I told them I had this going on, they downplayed it. So why should I go back? So when I'm in the community, my main goal is to rewrite the narrative for them. Show them that, yes, I am part of IU Health, but I see you, I understand, I can relate to you, and we can get this done together.
Yeah.
I want to be the change that I want to see in my community.
Yeah, I love that. And as you do these events and get more connected in the community, how have you seen the response and reaction?
I feel like it's been great. There have been, I've built a lot of trust. with people. I have a lot of returnees, people that may not even be getting their haircut that day, but they want to come back in. They know that I'm in there, or they're excited to let me know, hey, I'm checking my blood pressure every day. I've switched up how I'm eating. I've become more active. So they're really excited to have someone who they feel like genuinely cares.
Yeah.
They're like, oh, I know she genuinely cares. She's here. She's still here. She's coming back. I'm talking to them. I'm getting to know them. I'm building relationships, and I'm being very inclusive.
Yeah.
And that was a big part for me. I want to be inclusive. And by me building that trust, it allows them to see that, okay, you know what? I know what I experienced before, maybe by going to a doctor or things like that, but I'm willing to go ahead and try it again. I'm willing to try it again. So that's my main goal for me. Because like I always say, you know, black men and women are dying at alarming rates due to hypertension and cardiovascular disease.
Right.
So I'll just explain to them that they go hand in hand. So we just want to make sure that we're tackling those issues head on.
And education is so important.
Absolutely.
And so Jennifer, why is it important for IU Health to really have this community-centric vision? And in what ways do you all plan to expand that vision?
There are so many opportunities, and that's one of the things that I really saw when I started looking at the data. We knew there was opportunity there. We also are new to the community, and we really wanted to share our vision about partnering with our community, whatever means that is. So if we have to go out into the community to do that, which really is the best method, then we're going to do that. And we're going to do whatever it takes to build trust, to let people know that we're here and we're not leaving, and we want to be your trusted partner. I think we have lots of opportunity to expand. This barbershop idea has really blossomed into a lot of other ideas and other ways that we can utilize that space, which is a great, it's a great space where people already feel comfortable and safe. And so having those partnerships allows us to come in and automatically have that safety net and that support. So we have those great gentlemen that are supporting us in the background and building that support connection and that bridge for us. So it's been a really great opportunity, and we know that there's room for expansion on that.
Yeah, absolutely, because you are, like you said, building those relationships, coming back, being consistent, and actually bringing the health and education to them. But in reverse, people can also visit your facility, right? If they feel at any need that they need to come in to see a physician. I know that you have a lot of new and available physicians that can that are open and willing to help them in office too as well.
Yes, we do.
Yes.
We have 4 offices currently that are primary care. Lots of new physicians coming in, lots of opportunity for expansion and growth in the future. As our hospital is being built, and I'm sure all of you have seen that off of 69, we're really excited about that. We're getting even more excitement and more opportunities for the growth within primary care. So improving that access is our main goal.
Absolutely.
Yeah, I love it. Well, thank you both so much for coming in and
so
chatting
much,
with
Jessica.
me. And keep going. I love what you're doing in the community.
Yes, thank you so much.
Thank you.
And if you would like more information about IU Health, we'll have their website listed below. Remember, they have multiple locations that you can go and visit them. And I'll see you after the break. This segment sponsored by Indiana University Health.